Newton-Wellesley is really a true community hospital. The Community Collaborative embodies our vision of being here for our neighbors. Here at Newton-Wellesley, we represent a community home for people's health, somewhere that's familiar and trusted. We try to be that sense of community in this clinic so people feel comfortable walking through the door, even when it's to talk about really difficult things. People that were struggling were coming to us and saying, "Where can I go to find help?" We would refer them to our hospitals in Boston, and people would say, "I don't want to go into Boston. I want to be here in my community hospital." And that's what founded Substance Use Services. We've seen a constant need. It has continued to be an important service for our community. It's not necessarily always about a substance. It's about getting better, being healthier. There's so much hope in the recovery I see. Patients that had never really thought that they could have a different way of living. Now they're working even themselves in the community to help others and feel like champions themselves, full of hope, full of the joy of having their relationships back, their peace of mind back, their courage back. This is a place of hope and healing. It's really so amazing to be able to be part of those transformations for all of us.
I retired and started drinking heavily. It got out of control. One day my daughter-in-law called me to see if I could take care of the two kids while she ran to a doctor's appointment, and I couldn't because I was drunk. And I thought, wow, this is really getting to be an issue here. I didn't want to drink anymore, but it was such a part of my life. Just wanted to stop, but didn't know how. And then I went into a detox mode. And so I went to Newton-Wellesley Hospital. The nurse on duty there, she handed me a pamphlet to the SUS clinic. And she said, do yourself a favor and call these people. So I came home and I hemmed and I hawed and I thought I'm gonna be okay. You know, I'm not an alcoholic. You know, that's somebody else, it's not me. But I called and it was the best thing I ever did. Today is 2 years and 8 months for me to be sober. These people at the SUS clinics, they're angels. You just feel comfortable there. There's no judgment. They all just committed themselves to me in my journey, and I could never be where I am today without them. To say those words that I'm an alcoholic is a real tough thing to say. I took the step, and I'm sticking with it. I'm grateful for my sobriety. I'm enjoying my kids, I'm enjoying my grandchildren, enjoying my husband. It's changed my life around completely.
We're really proud of being part of the Community Collaborative at Newton-Wellesley. I'm really proud of the work that we're doing. I'm really proud of this hospital. In the Resilience Project, we talk a lot about how psychiatric illness is common and it's treatable. It gives me hope when I see families who are really struggling, kids who are really struggling, and we're able to work with them and get things turned around, and then see a child who's really thriving. So we're able to get into the schools, be out in the community, and provide that full spectrum of education prevention all the way to the clinical treatment.
Programs like the Resilience Project have really helped me as a mentor and educator and advocate. They've been a wonderful partner for us here at City Hall. We really want to make sure families feel equipped to be able to talk to their young people and know what to look for and what resources are available in their community. And the Resilience Project does just that.
If we can give our kids the right support, the right nurturing, and the treatment they need, if that's what they need, they come out of this hard time on the other side of this being stronger. There are lessons learned and opportunities and growth. So I think that also gives me a lot of hope. I get emotional talking about it.
Heart disease is one of the leading causes of death in the United States for both men and women. Our goal as a Cardiovascular Council is to improve the heart health of our community. And we know that firefighters are at high risk of heart disease. Cardiovascular events account for 45% of on-duty deaths. So we thought this is a great time to reach out to our community and take care of our first responders, the people who take care of us.
The members of this department put their lives on the line every day for the people that live here, the people that work here. At the end of their shift, these men and women, they deserve to go home and enjoy their family and enjoy their lives. And so we have to We have to try to protect that and try to protect them. We've always been interested in tools we can give to the department members to make them healthier. Tools just like this training here to improve their cardiac health. This is an extremely stressful job. Managing and dealing with stress is a huge benefit towards your cardiovascular health. They address a lot of those issues on the first day.
It's all about injury prevention, keeping them safe, making sure they stay on the job for a long time.
The biggest positive feedback we got was from the cooking part, talking about small changes you can make in the way you cook and what ingredients you use that can really improve the health of that recipe. Both the hospital and the fire department, we're serving the community. We're here to help people. We share that common goal. It was great for Newton-Wellesley to provide a service to us, and I think it hit home with a lot of the members.
The Maternity Services Council has helped over 1,600 patients since we've started 4 years ago. We're able to identify any mood disturbance, any anxiety, depression, any issues that someone may present with, in the beginning of their pregnancy, but then even postpartum after they've had their baby. Whether that's helping them find a therapist, helping them with medication management, helping them connect to a support group. It's hard to talk about, but having the screening done during pregnancy and at that 6-week postpartum visit is so important because then it's discussed.
Talking to someone can make a huge difference. I was struggling with infertility and I had a pregnancy loss. I felt that I was slipping into a depression. Talking to Buffy was extremely helpful. We met almost every week. I don't know how I would have done without her. I'm really grateful that she was there to listen to me and guide me through that. Postpartum is not easy, but I'm glad I have the help. Having a baby is a little overwhelming, but it's all worth it.
We have the resources here at Newton-Wellesley to really help someone. We can improve how they interact with their baby, their relationship with their families. It really is making this community stronger. You really see people improve, people get better. And I think that's what's so incredible about the work.
Our community has so many needs, and we are so fortunate that our councils are here to meet them. The Community Collaborative really allows for us to have a face of the community infused into the work that we do here. That allows us to better understand how can we do better? How can we learn how to heal better together?